Hey guys, it's Dr. Lee. I'm here for another dermpath lesson. So this one is a real quick one. We have a shave biopsy here. Remember, shave biopsies are broader than they are deep. And we have a couple of hair follicles here, and here's another hair follicle, some sebaceous glands. But the main action here is right here in the middle. And what you can see here from this power is that you'll see a gray tinge to it, and also a lot of these cleared out spaces. The gray stuff is actually solar elastosis, and now this is what happens to your skin when over a lifetime of sun damage. And you can see that these little elastotic fibers take on this gray appearance, so that's what we're looking at. So you can see here, these cleared out spaces are actually blood vessels, and here you have your endothelial cells, which are the cells that make up the blood vessel. Some of them are protruding out and look kind of plump, but there's really no significant atypia. So as you're looking at these blood vessels, some of them are sort of oriented parallel to the epidermis. It's kind of harder to make out in this section, but you have some parallel to the epidermis. That's characteristic of this lesion. So this is an acquired elastotic hemangioma. And these lesions tend to occur more commonly in older people. They need the sun damage to occur. And I think they're the most common on the forearm and probably the neck area. And the main keys to the diagnosis are a well-circumscribed proliferation of blood vessels. Some of the blood vessels are oriented parallel to the epidermis, all contained within the solar elastosis. And you can see it abruptly stops right there along the base. It's a quick and easy one. Thank you very much, guys. If you like what I'm doing here, please subscribe, turn on those notifications. I try to post something every single day. And share this if you think somebody else would find it helpful. Thanks.